Hello everyone and welcome to YS Medbus. I'm Yarini, your nursing tutor. They say every heartbeat tells a story, but as a nurse, are you listening carefully enough? As a student nurse, an absent pulse is the scariest moment you can face at the bedside. It is a clinical emergency or just a ghost pulse. Today I'm breaking down the 9 essential pulse points, the professional grading scale, and if you stay until the end, I'll share my hidden pulse troubleshooting guide to help you find a beat when everyone is struggling. Always remember, you can count for 30 seconds and multiply by 2 to get the pulse rate. But if it feels skippy or weird, count for a full 60. As per AHA guidelines, always use the pads of your index and middle fingers. They are your most sensitive clinical tools. Coming to the sides, temporal, right in front of the ear, carotid, next to windpipe. Never palpate both sides at once or your patient may faint. Apical pulse. This is the gold standard, located at the apex of the heart. It's the most accurate way to measure heart rate, especially if peripheral pulses are irregular or weak. Brachial in the bend of the arm. Our go-to for blood pressure. Radial, just below the thumb. This is your standard site for a quick check. Femoral and popliteal, found in the groin and behind the knee respectively. The feet, don't forget the posterior tibial behind the ankle and the dorsalis pedis on the top of the foot. Then we come to the grading scale. Once you find the pulse, how strong is it? We grade pulses on a scale of 0 to 4 plus, which 0 is absent, where there is no flow. This requires immediate clinical intervention. 1 plus is steady and weak, which is common in dehydration, hemorrhage or shock. 2 plus is normal. This is our Goldilocks zone. It indicates healthy cardiac output. 3 plus is often increased, which is seen with exercise, stress or early stage high blood pressure. 4 plus is bounding. The pulse feels like it's pushing your fingers away. We see this in fluid overload, high fever, or pregnancy. It suggests the heart is working overtime. Remember I said about the troubleshooting guide for the ghost pulse? What do you do when the pulse is missing? Try these 4 steps. The roller technique, don't just press down, place your fingers and slowly roll them side to side over the artery to feel the pulse. The warm-up technique. Cold rooms cause vasoconstriction. Wrap the patient's hands in a warm blanket for a minute to help the arteries dilate and try again. The gravity trick. If you can't find a hand or foot pulse, lower the limb below the level of heart. Gravity fills the artery, making the tap easier to feel. The 2-finger walk. Anatomy is not always textbook. Walk your index and middle fingers in a small circle around the area until you find the rhythm. If you have tried every trick and still get a 0, especially if the limb is cold or pale, don't panic. Sometimes it's just deep under the skin. Confirm with an apical pulse for a full 60 seconds or use Doppler. If you hear it on Doppler, you grade it as a Dopplerable rather than absent. If this helped you, hit the subscribe button for more nursing essentials. Stay rhythmic and I will see you in the next lesson. Thank you for watching.